Welcome to the topic Drugs for Bacterial Infections. In this, we will study about the pathogens. So the pathogens are the organisms that cause the disease by invading the tissues or the secreting toxins. These are the types of pathogenic organisms like bacteria, viruses, protozoan pathogens, multicellular parasites, fungi. All these are different kinds of the pathogens that causes the problems. Pathogenicity means the ability of an organism to cause any kind of infection. It depends on an organism's ability to bypass or overcome the body's immune system. Unfortunately, only a few dozen pathogens commonly cause the disease in the humans. These are some of the common bacterial pathogens. For example, the name of organism is Bacillus anthracis, disease is anthrax, and it appears in cutaneous and respiratory forms. Borrelia burgdorferi, Lyme disease acquired from the tick bites. Chlamydia trachomatis causes Venereal's disease, eye infection, which is the most common cause of the sexually transmitted infections in Canada. Enterococcus causes wounds, UTI, endocarditis, or bacteremia. Common opportunistic microbe and part of a normal flora of the urogenital and intestinal tracts. Escherichia coli, it's traveler's diarrhea, UTI, bacteremia, meningitis in the children. And it's also the part of the normal flora of our intestinal tract. Haemophilus causes pneumonia, meningitis in children, bacteremia, otitis media, sinusitis. So some species are part of the normal host flora of the upper respiratory tract. Klebsiella causes pneumonia or UTI. Common opportunistic microbe is this one. Mycobacterium tuberculosis causes tuberculosis. Incidences are very high in the patients infected with the human immunodeficiency virus. Then Mycoplasma pneumoniae causes pneumonia, most common cause of the pneumonia in the patients ages 5 to 35 years. Neisseria gonorrhea, gonorrhea and other sexually transmitted infections, endometriosis, neonatal eye infections, and they can be also the part of the normal host flora. Neisseria meningitidis, so it causes meningitis in children. It can be part of the normal host flora. Pneumococcus, pneumonia, otitis media, meningitis, bacteremia, endocarditis. It is the part of the normal flora in the upper respiratory tract. Proteus mirabilis causes UTI and skin infections, which is part of normal flora in GI tract. Pseudomonas aeruginosa causes UTI, skin infection, septicemia, common opportunistic microbe. Rickettsia rickettsii, Rocky Mountain spotted fever acquired from the tick bites. Salmonella enteritis causes food poisoning, and it's from infected animal products, raw eggs or undercooked meat or chicken. Then Staphylococcus aureus causes pneumonia, food poisoning, impetigo, wounds, bacteremia, endocarditis, toxic shock syndrome, osteomyelitis, and UTI. It can be part of the normal host flora on the skin and the mucous membranes. Then Streptococcus causes pharyngitis, pneumonia, skin infection, septicemia, endocarditis, or otitis media. And some species are the part of the normal host flora of the respiratory, genital, and intestinal tracts. So these pathogens, they are virulents, and the highly virulent organisms can cause disease in very small amounts. They cause the disease in two mechanisms, and invasiveness is the ability of the pathogen to grow rapidly and damage the surrounding cells before the immune system can engage. Toxins are produced and can be in very minute amounts, disrupt normal cellular activity, and can be very harmful in this one. So all the anti-infective drugs that we used against these pathogenic organisms, they are classified by their chemical structures or by their mechanism of actions. So when we do the classifications, the one classification includes the antibiotics, which is a natural substance produced by the bacterial that can kill other bacteria. Then we classify according to their chemical structure. Those anti-infectives that belong to the same chemical class usually share the same similar properties. And the one with the pharmacological classification, the cell walls inhibitors, protein synthesis inhibitors, folic acid inhibitors, and reverse transcriptase inhibitors. So this is how we classify the drugs. Again, the method of describing and classifying bacteria is how we see that this is this bacteria and this is the other one. So we try the staining technique and we separate them as this is a gram-positive bacteria, this is a gram-negative bacteria. Then we recognize with the shape. If it's a rod shape, we call them as bacilli. If it's a sphere in shape, cocci. If they're spirals, they're spirilla. Then we also find out some bacteria are present in the presence of oxygen. They're called as aerobic, and some without oxygen, we call them as the anaerobic bacteria. So these anti-infective drugs that we will study, they will act by selectively targeting a pathogen's metabolism or a life cycle. Now we know what infection is caused by which bacteria. Now we can give the antibiotic according to them. So the primary goal that we find out for the antimicrobial therapy is to assist the body's defenses in eliminating a pathogen. The bactericidal drugs, they kill the bacteria, and the bacteriostatic drugs, they slow their growth, allowing the body's natural defenses to eliminate the microorganisms. So bactericidal, cidal means killing, static means slowing their growth or stopping their growth. So this primary goal of antimicrobial can be explained by the mechanism of action. So we can see here, the drugs, they are going to act onto the RNA synthesis and they are going to inhibit them, for example, rifampin. Then we made some drugs which are protein synthesis inhibitors. They are going to stop the protein synthesis like aminoglycosides, ketolides, macrolides, streptogramins, and tetracyclines. There are some drugs which are anti-metabolites, sulfonamides. There are some drugs which are going to stop the synthesis of the DNA, like fluoroquinolones. Then some will cause the inhibition of the cell wall synthesis. And they are the carbapenems, cephalosporins, isoniazid, penicillins, and vancomycin. So the acquired resistance in our body is a major clinical problem that is worsened by the improper use of anti-infectives. Like first is nosocomial infection, which can be acquired in hospital or other healthcare settings. They often resistant to the common antibiotics, and the two particular serious resistant infections, they are like this is acquired resistance. What we do, infection, we see a resistant organism, we take it in the Petri dish, and we are seeing that it's antibiotic, which kills all the organisms except the resistant one only. After some time, we will see that resistant organism that remained, now it has rapidly divided to infect the patient. So antibiotic is no longer effective for that person. Now, the safest drugs we are going to use for anti-infectives started with the penicillin, and this is the general structure of the penicillin, which there is acyl side chain, beta-lactam ring, and one thiazolidine ring in it. So the actions of the penicillins, they are going to act onto the body, and they kill the bacteria by disrupting their cell wall. The chemical structure of the penicillin that is responsible for its antibacterial activity is called as the beta-lactam ring that we just saw. Other than that, it also causes resistance. So some bacteria, they secrete an enzyme from the mouth called as the beta-lactamase enzyme, or which is called as penicillinase, which splits the beta-lactam ring. And the structural change allows the bacteria to become resistant to the effect of the most penicillins. So then now the penicillin is not working on the patient, then we have to do something else. So these modifications of the natural penicillin molecules produced the drug's advantages. We make penicillinase resistant penicillins then, like oxacillin, cloxacillin, and then we have the broad spectrum penicillins like ampicillin and amoxicillin. Then we have extended spectrum penicillins. So that's how we modify the penicillins into three different categories. Like extended is piperacillin. Then who are allergic to penicillins, they can go for cephalosporins. So cephalosporins are similar in structure and function to penicillins and are one of the most widely prescribed anti-infective classes. These cephalosporins, they contain also the beta-lactam ring. They're bactericidal, like they're gonna kill the bacteria. They inhibit the bacterial cell wall synthesis. Their primary therapeutic use is against the gram-negative infections and the patients who cannot tolerate the less expensive penicillins. They cross allergy with the penicillins, and they're classified by their generations. The cephalosporins, they have the first generation, which contain beta-lactam ring. The bacteria producing the beta-lactamase normally will be resistant to these agents. The second generation cephalosporins, they are more potent and more resistant to beta-lactamase and exhibit a broader spectrum than the first generation drugs. They are more commonly prescribed drugs. Then we get the third generation cephalosporins, which are generally having a longer duration of action and even broader spectrum and are resistant to beta-lactamases. Then we made fourth generation drugs. We are more effective against organisms that have developed resistance to the earlier cephalosporins. So there are not always the clear distinctions between the generations, but one after the other, we made it to improve them, we modify them, and we give them the generation names. Then we made the class, which is tetracyclines. Tetracyclines also have a broad spectrums, but the drug of choice for few diseases as well. So in this one, we separate the gram-positive bacteria and gram-negative bacteria. The tetracyclines are most oftenly used as bacteriostatic. So they slow down the growth of the bacteria. They stop the growth of the bacteria by inhibiting the bacterial protein synthesis. They are effective against a wide range of gram-negative and gram-positive, both, and have one of the broadest spectrums of any class of antibiotics. These tetracyclines, we counsel the patients urged not to drink milk with tetracyclines because these medications bind the ions such as calcium and iron, and thereby decreasing the drug's absorption by as much as 50%. So we also avoid the drug exposure, direct exposure to the sunlight, because these tetracyclines can cause the photosensitivity also. Other than that, the patients younger than 9 years are not given tetracyclines because these drugs may cause permanent yellow-brown teeth discoloration in the young children. Another category comes as the macrolide antibiotics. So they inhibit the bacterial protein synthesis, that's how they work, and they act both. So they have bactericidal effect and bacteriostatic effect as well. So they kill the bacteria also, they stop the bacteria also. It is also a safe alternative to the penicillin who are allergic to penicillin, like erythromycin and clarithromycin, we can give them. So these macrolides, what we learned, they are the safe alternatives to the penicillins for many infections. Another category is the aminoglycosides. So the treatment of a number of microbes, gram-negative bacteria, mycobacteria, and some protozoans. They are bactericidal, inhibit the bacterial protein synthesis. The aminoglycosides also show some adverse effects like ototoxicity. It's the damage to the inner ear, causing the hearing impairment, dizziness, loss of balance, persistent headache, and ringing in the ears. Causes nephrotoxicity, which is kidney damage recognized by abnormal urinary function test, such as elevated serum creatinine or the blood urea nitrogen. So these aminoglycosides, they are narrow spectrum drugs. They are not the broad spectrum, and that have the potential to cause the serious toxicity. So it's not a drug of choice. Then another category is the fluoroquinolones. They have the wide clinical applications because of their broad spectrum of activity and relative safety. So these fluoroquinolones, they are active against the gram-negative pathogens. They are newer ones and are significantly more effective against gram-positive as well. That's why it becomes broad spectrum. They shows the bactericidal effect. They inhibit the bacterial DNA synthesis. And the adverse effects includes the dysrhythmias, hepatotoxicity, and cartilage toxicity possibly. Another class is the sulfonamides. So it's a wide spectrum of activity done by the sulfonamides. It suppresses the bacterial growth by inhibiting the folic acid, an essential substance in cellular metabolism. And these sulfonamides, and the urinary antiseptics, they are actually the traditional drugs for the UTI infections. Other, we have the miscellaneous anti-infectives, like they're critical drugs for specific infections. Like they cannot be grouped into classes. For example, clindamycin, which is the drug of choice for oral infections. And we use vancomycin, which is reserved for the severe infection, which is caused by the gram-positive organisms. So all the drugs that we studied for the bacterial infections, like classifications for cephalosporins. So first generation includes the cefadroxil, cefazolin, cephalaxin. Then second generation includes cefaclor, cefprozil, cefuroxim. Third generation is cefixim, cefotaxim, ceftriaxone. Fourth generation is the cefepime. Aminoglycosides, amikacin, gentamicin, neomycin, paramomycin, streptomycin, tobramycin. Tuberculosis, ethambutol, isoniazid, and rifampin. We use fluoroquinolone, ciprofloxacin, gatefloxacin, levofloxacin, moxifloxacin, norfloxacin, ofloxacin. Then we have macrolides, azithromycin, clarithromycin, erythromycin. And the miscellaneous drugs, clindamycin, lincomycin, metronidazole, and vancomycin. Thanks for watching the video.